Hello guys, good evening to all of you, and I hope all of you guys can hear me. And today, guys, good evening to all of you guys. All right, guys, I hope all of you are doing well, and you had a great week with anti-cancer drugs. Good evening, Sri Priya, Saqib Ahmed, Abhinandan Maiti. Good evening to all of you. So, Harshnil, good evening. So, guys, today our aim is to cover up anti-cancer drugs. Again, I've made 15 new MCQs on anti-cancer drugs. Anti-cancer drug is a difficult topic, right? The MCQs you'll find in your exams, you might find them difficult, but see, you need not worry too much about anti-cancer drugs. If you are not able to capture the entire topic of anti-cancer drugs, just do two things: drug of choice and side effects, right? You'll find in the revision videos I've covered only drug of choice and side effects. If you can do that much, then also it is enough, right? So good evening to all of you guys. All right, so let us start with today's. So guys, we have already reached, you can see, to week 8, and that is anti-cancer drugs. And today we'll be covering around 80% of pharma. The rest 20% will cover up. All right, let's move on, guys, to the first question today, right? Good evening, guys. Good evening to all of you. All right, so the first question is obviously it's a topic that is quite commonly asked in our exams, and that is chemotherapy. It always results in nausea and vomiting. So let us make a regimen for prevention of nausea and vomiting for a patient on cisplatin by using drugs given in the option, right? Look at the four options: ondansetron, aprepitant, dexamethasone, olanzapine. Four drugs are there. Let me remind you, all of them, they can be used in chemo-induced nausea vomiting, right? So what can we use? So this is a live one, guys. This is not premier. This is not premier. This is a live one. This is not premier, right? Priya Minnu, this is not premier. This is live. So A, B, C, D. So 1, 2, 3, 1, 2, 1, 3, 4, 1, 2, 3, 4. So whatever you think is the possible answer, you guys can let me know. Whatever you think is the possible answer. Is it 1, 2, 3, 1, 2, 1, 3, 4, or 1, 2, 3, 4? Right. So you can take some time to ponder upon the options, and then you can let me know. Cisplatin, it causes severe nausea and vomiting. So see, nausea vomiting can be mild, it can be moderate, it can be severe. Nausea vomiting can be mild, it can be moderate, it can be severe. So guys, you must answer. Even if you don't know the answer, try to answer. Try to go for one answer, right? Try to go for one answer. Right, so in this case, it is severe. In this case, it is severe. All right, so remember here, all of you, excellent guys. Many of you have given the right answer, and I'm proud of all of you, each one of you who have given the answer right. And here the right answer is option D. Now remember, severe nausea vomiting, we are going to use 4 drugs. Severe nausea vomiting, we are going to use 4 drugs. And those 4 drugs are this 1, 2, 3, and 4, all of them. So see, the reason why I have made this MCQ is not only to test your knowledge, but also to let you know, if you don't know, you can add this to your notes. Severe nausea and vomiting, I'm going to use 4 drugs. Otherwise, if it is mild to moderate nausea vomiting, I usually use 3 drugs. 3 drugs: ondansetron, aprepitant, dexamethasone, right? So if there is mild to moderate nausea vomiting, I'll be using 3 drugs: ondansetron, aprepitant, dexamethasone. Most of the times, they ask an MCQ on cisplatin. The reason being, cisplatin is the most hematogenic anti-cancer drug. It is the most hematogenic anti-cancer drug, right? All right, guys. So anyways, even if you have given the answer wrong, it's okay. It's fine. Nothing to worry about. If they ask you in your exam, remember, severe nausea vomiting, 4 drugs. Mild to moderate, I'll be using 3 drugs, right? All right. Which of the following is a PDL1, programmed death cell ligand 1 inhibitor? So all of you know, right, nowadays the INICET exam is already knocking on the doors. And for INICET, the immune checkpoint inhibitors are important. They ask MCQs. So I have made one new MCQ. So on immune checkpoint inhibitors, I've made some new MCQs. In the revision videos, I've given you the mnemonics, etc., how to remember, right? So which of the following is a PD-L1 inhibitor? Ipilimumab, retifanlimab, pembrolizumab, avelumab. Right, so do expect, if you are preparing for INICET, do expect MCQs from the immune checkpoint inhibitors. If you don't know, it's okay, it's fine. Whatever, just comment, just random, you can, whatever comes into your mind. Whatever comes to your mind. You can comment whatever comes to mind. Just make a random guess. So see, whoever, all of you who are watching, right, you must comment on each and every question. The reason being, I'm not awarding marks here, right? I'm not giving any marks here. So what do we think is the possible answer? Anyways, all right. Now say immune checkpoint inhibitors. Fine, immune checkpoint inhibitors. So the mnemonic, I have revised the mnemonic because of new drug that was approved in 2023. Retifanlimab was approved in 2023. So the mnemonic is rising new star drugs acting at immune checkpoint, right? Now among these drugs, from durvalumab, avelumab, and atezolizumab, right? These are PD-L1 inhibitor, right? Ipilimumab is CTLA4 inhibitor. Everything else is PD-1 inhibitor. Everything else is PD-1 inhibitor, right? Everything else is PD-1 inhibitor. So in this mnemonic, you can remember. How to remember, I'll tell you. See, to remember which are inhibitors of ligand, just remember a mnemonic L, right? So look at these drugs, D, A, and L. Dal bhat, dal roti, whatever it is. So remember, in this dal, one D is not there, dostarlimab is not there, right? So these drugs are nearby, durvalumab, avelumab, atezolizumab. So DAL, or you can remember from here, DAL. These are ligand inhibitors, right? PD-1 inhibitors, CTLA4 inhibitors. This is what probably they can ask here. Now see, immune checkpoint inhibitors, there are few more MCQs that are made here for INICET. We'll discuss those as well. So now at least those who have not commented, can you at least comment now, right? Those who have not commented, can you at least comment now? What is the answer? Which of the following is a PD-L1 inhibitor? Come on, guys. At least now you can guys can comment, right? Don't eat dosa with dal. See, Abhinandan, does not matter how you answer. Our aim is to get the answer right. No matter how you answer, our aim is to get the answer right. Excellent, guys. Excellent. All of you have given the answer right now. Let us move on to the next MCQ. A patient of renal cell cancer underwent nephrectomy, right? Look at the next MCQ, and was planned to be started on adjuvant therapy with a drug. Which of the following drugs is most preferred in current scenario? So look at the cancer, renal cell cancers, all of you know, depending upon how widespread the cancer is, I can go for a partial or total nephrectomy, and then I'll go for adjuvant chemotherapy. What should I use? Option A, bevacizumab, B, pembrolizumab, C, everolimus, D, cabozantinib. A, bevacizumab, B, pembrolizumab, C, everolimus, D, cabozantinib. Come on, guys. All of you must answer. Come on. I've made this MCQ for a purpose. Come on. Quick. Answer करो, सबके सब answer करो, जल्दी करो, answer करो. I made this MCQ for a purpose. There is a purpose as to why I made this MCQ. All right, देखो, many of you guys have given the answer as bevacizumab. I have given bevacizumab as a honey trap. Bevacizumab is not the answer. Bevacizumab used to be the drug of choice, but you know that immune checkpoint inhibitors, they have changed the scenario, right? Now I've removed bevacizumab. Now can you give me the answer? Okay, many of you have commented A. A is a decent answer. It's not the right answer, but I'm not saying it's a bad answer. It's a good answer because bevacizumab used to be the drug of choice. It's no longer the drug of choice. So let us remove bevacizumab. Now B, C, and D are left. Now tell me what is the answer. All right. Those who are going for C, again, C is not the answer. C was the second honey trap. The reason being, everolimus, it is used in renal angiomyolipoma. Renal angiomyolipoma, which is seen in tuberous sclerosis. It is not used for renal cell cancer. Okay, two are left. Can you at least tell me the answer now? Is it B or D? See, B and D both can be used now, right? B and D both can be used. It is first line, cabozantinib is second line. So here, your better answer is pembrolizumab. So those who have done it wrong, please change it in your notes. The drug of choice for renal cell cancer has changed. And I've told this in my revision videos in Mero. I've updated that. Right, the drug of choice for renal cell cancer is pembrolizumab. Excellent, guys. Now all of you have given the right answer. So you understood, right? In these sessions, my aim is not only to test you, but also to update you guys, because I know if this MCQ would be asked, many of you would go for bevacizumab as the answer. I don't want that to happen. So in these sessions, we'll not only test your knowledge, but also we'll keep on updating your notes. Wherever there are changes, we'll keep on changing them. Excellent, guys. Excellent. Most of you are correct now. All right. Let's look at another thing. A postmenopausal female with breast cancer underwent surgical removal of tumor and had a high risk of recurrence. Which of the following adjuvant chemotherapy should be started? Abhinandan Maiti, yeah, I have told in the revision video, I have updated it. So if you have watched the revision video, it's updated. So Abhinandan, that means you have watched it. Excellent. A postmenopausal female with breast cancer underwent surgical removal of tumor and had a high risk of recurrence. Which of the following adjuvant chemotherapy should be started? Right. Option A is wrong. Yes, option A is wrong. Right. So there is a breast cancer, postmenopausal female, there is a high risk of recurrence. What should I give? Tamoxifen plus abemaciclib, letrozole plus abemaciclib. All right, come on. See, all of you know breast cancer is the most common cancer nowadays. There is a reason why I have included one MCQ on breast cancer, and it's a good one. All right. All right. Breast cancer. I'll give you some updates on breast cancer. Please add that to your notes. Yeah, you can see. Abhinandan has excluded A and B. So you guys could have also excluded. So you have to just go for one option. So breast cancer, see, if it is ER positive, premenopausal and postmenopausal. See, premenopausal, we use tamoxifen. Now, it does not mean I cannot use tamoxifen in postmenopausal. Please don't get that concept. That is a wrong concept. I can use tamoxifen even in postmenopausal, but it is not the drug of choice. If you want, you can use it. Postmenopausal, the drug of choice is letrozole. Now, beyond this, there are two things you need to understand in postmenopausal or premenopausal female. If there is a high risk of, there could be high risk of recurrence, or it can be BRCA positive. So these are two new things. Please add this to your notes. If there is a high risk of recurrence, then you will add abemaciclib. It is a cyclin-dependent kinase 4/6 inhibitor. If it is BRCA positive, then you will add a drug called as olaparib. It is a PARP blocker. Now these are, see, why I have asked this MCQ, the reason being, you would have seen in the last 5 years, umpteen number of times they have asked regarding what is the drug of choice in premenopausal, tamoxifen, what is the drug of choice in postmenopausal, letrozole. The same thing has been asked time and again. Now it's high time to update the MCQs, isn't it? So what is that they're going to ask you is about if there is a high risk of recurrence. So what is the role of abemaciclib and what is the role of olaparib? All of you know that, right? So now let us go back. So I have taught you this just to let you know. Now you should pick up the answer. So at least now let me know what is the possible answer. Is it A? Is it B? Is it C? Or is it D? What do you think is the answer? Is it A? Is it B? Is it C? Or is it D? All right. So now at least you can know. Tell me the answer. All right. Now those who have not commented, you guys can comment now and let me know the answer. Very good guys, very good. So the answer is letrozole plus abemaciclib. Letrozole plus abemaciclib is the right answer. All right, let us move on. Nivolumab is used for treatment of Hodgkin's lymphoma. Nivolumab is used for treatment of Hodgkin's lymphoma. Now see, nivolumab is used in Hodgkin's lymphoma. It is itself an MCQ of INICET. They asked you, nivolumab is used for which disease? Your answer was Hodgkin's lymphoma. I've taken that MCQ and made another MCQ. Nivolumab is used for treatment of Hodgkin's lymphoma with AVBD as initial regimen, without AVBD as initial regimen. It is used for treatment of Hodgkin's lymphoma that has relapsed post AVBD. D, that has relapsed post pembrolizumab. All right, so it can take some time. This is a difficult MCQ, obviously. Now see, nivolumab is used in Hodgkin's lymphoma. By this MCQ, I'm trying to give you some knowledge as to what is the actual use of nivolumab in Hodgkin's lymphoma. Because you know, Hodgkin's lymphoma, nivolumab is not the drug of choice, isn't it? Right. So this is a PYQ, an MCQ from PYQ. So I should know the PYT. I should know the topic if the MCQ is repeated, right? So what do you think, guys? All right. You know, as the initial regimen, I never use nivolumab. The initial regimen I use AVBD is the treatment of choice. Treatment of choice for Hodgkin's lymphoma is ABVD. Now, if it relapses, in that case, number one, I can use either nivolumab or I can also use pembrolizumab. I can use nivolumab or pembrolizumab. Both can be used. So here, obviously, you know, the answer is option C. Option C is the right answer. That has relapsed post AVBD. So D is not right, because you can use either nivolumab or you can use pembrolizumab. You can use either nivolumab or you can use pembrolizumab. So again, this MCQ has been asked. So again, I gave you one important knowledge as to what is the role of nivolumab in case of Hodgkin's lymphoma, right, guys? So excellent, guys. You guys are great sport. You guys are participating, and that is amazing, right? Even in a difficult topic like anti-cancer drugs. Which of the following drugs will be used for treatment of advanced metastatic endometrial cancer? Which of the following drugs would be used for treatment of advanced metastatic endometrial cancer? pembrolizumab, carboplatin plus paclitaxel, carboplatin plus paclitaxel plus pembrolizumab. All right. Again, this is an MCQ that I made from a PYQ of INICET. These are not PYQs, but they are related, closely related to PYQs, right? Which of the following drugs would be used for treatment of advanced metastatic endometrial cancer? Advanced metastatic endometrial cancer. Pembrolizumab, carboplatin plus paclitaxel, carboplatin plus paclitaxel plus pembrolizumab. Right. Let me know. Let the comments flow. Let me know what is the answer. A, B, C, or D? What is the answer? A, B, C, or D? Excellent, guys. Most of you have given the answer right, and I'm really proud of you guys. I'm really amazed that many of you have given the right answer. The answer is carboplatin plus paclitaxel plus pembrolizumab. Now remember, if it is not advanced case, then I can use carboplatin plus paclitaxel in non-metastatic, non-advanced endometrial cancer, right? Now what they had asked, an MCQ they had asked you pembrolizumab is used for. What was the answer? That PYQ. I'm telling you about the PYQ. Pembrolizumab is used for what your answer was, endometrial cancer. In this MCQ, I have told you where exactly is pembrolizumab is used in endometrial cancer. It's not the drug of choice in endometrial cancer. It is reserved for treatment of advanced metastatic endometrial cancer, where I take the initial regimen, that is carboplatin plus paclitaxel, and combine pembrolizumab to that, right? So I've covered another PYT, previous year's topic, right, of INICET. Which of the following drugs can be used to prevent cisplatin-induced nephrotoxicity? I've taught you this in the marrow lectures: leucovorin, amifostin, furosemide, 5% dextrose. Yeah, Abhinandan, I have highlighted in red color endometrial cancer. Yeah, because it has been asked. Hi, Subhasha, Dhara. Hi. So all of you are joining late. Hi to all of you. All right, guys. So let me know what is the answer. Which of the following drugs can be used to prevent cisplatin-induced nephrotoxicity? Now, this is after giving a lot of difficult MCQs. I felt a little bit pity that I should give at least some easier MCQs, isn't it? So leucovorin, amifostin, furosemide, 5% dextrose. All right, guys, so cisplatin-induced nephrotoxicity. Excellent, guys, excellent. Most of you are given the answer right. It is amifostin. Amifostin is actually a radioprotectant. And how does it protect from radiation? It is actually a free radical scavenger. It is a radioprotectant, free radical scavenger. Amifostin, saline, mannitol, it's excellent. Abhinandan, it's excellent. Abhinandan has done the revision videos nicely, it seems, right? So before I can say, so what else can I use? I can use normal saline, I can use mannitol, right? So three things are used to prevent cisplatin-induced nephrotoxicity: normal saline, mannitol. Pranav Singh, thank you very much. I really work hard to make these MCQs, guys, so that I can give you something different in these sessions, right? Not just PYQs, but something different. All right, look at the next question. A patient on anti-cancer therapy presented to the emergency with complaints of fatigue and breathlessness for last 1 week. On echocardiography, there was dilated cardiomyopathy and decreased ejection fraction. What drug should be given to prevent this toxicity? Pyridoxine, leucovorin, dexrazoxane, D-penicillamine. Now, this MCQ has been asked in your exam, but not like this. I've changed the way it has been asked, right? I've changed the way it has been asked. I've not asked exactly like that. I've changed the way it has been asked, right? Though and not only once, this MCQ would have been asked in the last 10 years or 15 years. I can say at least 10 times it has been asked. At least 10 times it has been asked, right? There it is. Now the right answers are flowing. That means you guys have got a hang of what I'm asking here, isn't it? So guys, this is basically cardiotoxicity or cardiomyopathy, which can be seen with doxo and daunorubicin, and they produce cardiotoxicity due to free radicals, and free radicals are because of iron. So iron dependent free radical production, and that is the reason why I chelate iron by giving dexrazoxane. So iron chelating agent. Very good, guys, very good. So you have caught me here. So it was, anyways, this is not a honey trap, right? This was a consolation MCQ, right? So all of you must do such MCQs, you must do right. See, these MCQs are MCQs which will make sure that you are in the race. It's an easy one, it's not a difficult one. All right, excellent, guys, I'm proud of all of you. Which of the following drug is an inhibitor of BCR-ABL tyrosine kinase at the allosteric site? Look at the options: imatinib, sunitinib, abemaciclib, asciminib, right? All right, guys, so what is the answer? What is the answer? Imatinib, sunitinib, abemaciclib, asciminib. Abhinandan Maiti, trastuzumab can also cause cardiotoxicity. But trastuzumab cardiotoxicity, there is no antidote as such. Which of the following drug is an inhibitor of BCR-ABL tyrosine kinase at allosteric site? Come on, guys, come on. Let me know what is the answer. What is the answer? Quick. Very good. मैंने यहाँ पर एक गड्ढा खोदा था, उस गड्ढे का नाम है इमाटिनिब. आप सब उस गड्ढे में कूद गए. इमाटिनिब इज नॉट द राइट आंसर, गाइस. इमाटिनिब इज नॉट द राइट आंसर, राइट? देखो, जब आसान क्वेश्चन शुरू हो जाता है ना, तो आपको ये लगता होगा कि अरे सर ने ये भी आसान बना दिया. यार सर क्या पूछ रहे हो सर, इतना आसान सवाल क्यों पूछ रहे हो, राइट? इतना आसान नहीं है भाई. इमाटिनिब इज नॉट द आंसर. Imatinib is not the answer. See, CML, I've told you this. In CML, I use imatinib. If there is no response, I use dasatinib, bosutinib, nilotinib. If there is no response due to T315I mutation, in that case, number one, I can use asciminib, omacetaxin. I can also use interferon alpha. This much you must know in CML. CML, I've taught you this in the revision videos. I've taught you this. This much you must know, right? So I've taught you this, that you'll do imatinib. Otherwise, you'll use DNB. If not, so see, imatinib is first generation. These are second generation. All right, so all right, I forgot here one more drug. I forgot, that is ponatinib. And ponatinib is third generation. These are inhibitors of the enzymatic site. Asciminib is inhibitor of allosteric site. Omacetaxin is inhibitor of protein, right? So these are inhibitors of BCR-ABL tyrosine kinase enzymatic site, allosteric site, BCR-ABL protein. Interferon alpha, all of you know the mechanism is quite different. So right, so what is the answer here? The answer is asciminib, guys. The answer is asciminib. I told you this. The answer is asciminib. Asciminib is the answer. Anyways, if you did it wrong, it is okay. Nothing is lost yet. Asciminib is the allosteric inhibitor. That is the reason why it is effective. Even if, say, if these are not effective, the green ones, if the green ones are not effective because they inhibit enzymatic site, I can use the black one, asciminib, because it blocks allosteric site, or I can use omacetaxin that blocks protein, or I can use interferon alpha, but interferon alpha is not that preferred because of toxicity, right? So answer is D. Excellent, guys. Most of you given the answer right. Amazing, 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 guys. You guys are real sport, right? Which of the following anti-cancer drug is a differentiating agent? Now, this is an easy one, right? Allosteric site is catch point. Lucky Mishra, yes. So Lucky Mishra, you are lucky. You caught the point, right? L-asparginase, retinoic acid, hydroxyurea, methotrexate. Which of the following anti-cancer drug is a differentiating agent? Come on, I've taught you this. I've taught you this, which is a differentiating agent. Do you guys want a clue? Do you guys want a clue? Okay. Differentiating agent means a drug that can convert immature myelocytes into mature myelocytes. This process is called as differentiation. So a drug that can convert immature myelocytes to mature myelocytes. So which drug can cause this differentiation? That is the reason why I'm asking which is a differentiating agent, right? Now guys, the answer is, if you don't know the answer is retinoic acid. And normally what happens for this differentiation, there is a receptor called as RAR alpha, retinoic acid receptor alpha. So retinoic acid, it acts upon RAR alpha that causes differentiation. And normally what happens is, if there is a block in differentiation, then there is increased immature myelocytes, and this is called as PML, pro-myelocytic leukemia. What is the translocation in PML? What is the translocation in PML? Let me know. What is the translocation in PML? Pro-myelocytic leukemia. What is the translocation? Pro-myelocytic leukemia. What is the translocation? Anyone guess? So nobody. See, normally pro-myelocytic leukemia, it is because of translocation 15-17. Very good. Now see, translocation 15-17, it produces weak RAR alpha. Very good. Translocation 15-17 produces weak RAR alpha. And this weak RAR alpha, they cannot convert immature myelocytes into mature myelocytes. That is the reason why I give retinoic acid from outside, making the concentration supraphysiological. So if receptors are weak, what I do, I increase the concentration of retinoic acid. If it is retinoic acid resistant PML, then I can use arsenic trioxide, and Pranav Singh is right there. Very good, Pranav Singh. Then we can use arsenic trioxide, right? Excellent, guys. Trastuzumab can be used in all of the following except breast cancer, uterine cancer, gastric cancer, hepatocellular cancer, right? Now guys, trastuzumab is a commonly asked drug, and obviously they ask most of the times about breast cancer, but I moved a little bit away from breast cancer, venturing into some other uses of trastuzumab which can be asked in your exams. So anyways, you guys can rule out at least two options. At least you should be able to rule out two options. Then from the remaining two options, you should be able to, you should go for one answer. You should go for one answer, right? From the remaining two options. So whatever you think, guys, whatever you think is the possible answer, let me know. whatever you think, भाई जो आपको लग रहा है अंदर से, जिस ऑप्शन के प्रति आपको प्यार आ रहा है, जिस पे प्यार आ रहा है उस पे प्यार बरसा दो. ए है, बी है, सी है, डी है, क्या है? Whatever you think is the possible answer. If you don't know, make a wild guess. Make a wild guess. Right? Is it A, B, C, or D? Just make a wild guess. Excellent guess. Though it's a difficult MCQ, many of you guys have given the right answer. Answer is D, hepatocellular cancer. So remember, breast cancer, uterine cancer, gastric cancer, plus colorectal cancer can be HER2 positive. So basically, what you need to remember is number one, HER2 female cancer. And what is female cancer? Breast cancer, uterine cancer, female cancer, right? Second is GID cancer. And what in GID? GID, gastric cancer, colorectal cancer. That is how you can remember what are the uses of trastuzumab. What are the uses of trastuzumab? All right, excellent guys. So D is the answer. Now moving on guys to the next MCQ. All of the following drugs can be used in treatment of trastuzumab resistant breast cancer except pertuzumab, lapatinib, neratinib, sunitinib. Again, this is a PYQ that was asked recently. I've changed that and made another MCQ, new MCQ. It's not PYQ. So all of the following drugs can be used in treatment of trastuzumab resistant breast cancer except pertuzumab, lapatinib, neratinib, sunitinib. Whatever you think, guys, whatever you think is the possible answer, do let me know in the comment box. Whatever you think is the possible answer here. Excellent, guys. Most of you have given the answer right. Answer is D, sunitinib. Now see, HER2 positive breast cancer. HER2 positive breast cancer. How to remember? I'll give a mnemonic. Two nipples to nipples penetrating lump. You know, HER2 positive breast cancer can penetrate the nipples as well, right? So here, the drug of choice is trastuzumab. Trastuzumab is the drug of choice. If the patient does not respond, I can use either neratinib or I can use pembrolizumab or I can use lapatinib. So this is the mnemonic, guys. This is a mnemonic which you can use to remember which drugs can be used in trastuzumab resistant, right? So 3 drugs you must know, because see, everybody knows what is the drug of choice for HER2 positive breast cancer. You know this, right? You know this. So this is what they're going to ask next. What can be used? Now see, remember, you might have this doubt that, pembrolizumab, I wrote it. I'm obsessed with the immune checkpoint inhibitors, just like your examiners. It's pertuzumab, not pembrolizumab, right? Pertuzumab. Anyways, so these are 3 drugs. Now, one doubt you might have, that trastuzumab and pertuzumab both inhibit HER2. Both are anti-HER2 antibodies. Neratinib, lapatinib, these are HER2 tyrosine kinase inhibitors. Now, if these are both inhibitors of HER2 receptor and trastuzumab is not effective, how pertuzumab is effective? The reason being, the site of action for pertuzumab on the HER2 receptor is different. For example, what does it mean is, suppose this is my cell and suppose this is tyrosine kinase, and suppose this is the receptor. Suppose this is the HER2 receptor. Now there is one binding site for trastuzumab, there is one binding site for pertuzumab, and there is one binding site for lapatinib and neratinib. Now you understand what this means. My drug of choice for HER2 positive breast cancer is trastuzumab. If I cannot use trastuzumab, I can use pertuzumab because it binds to a different site on the receptor. If I cannot use pertuzumab, I can use lapatinib or neratinib because they have nothing to do with the receptor HER2. They directly go inside the cell and block tyrosine kinase. I hope this is clear, right? Now let's move on, guys. All of the following are used for treatment of osteosarcoma except, right? All of the following are used for treatment of osteosarcoma except low-dose methotrexate, ifosfamide, doxorubicin, cisplatin. All of the following drugs are used for treatment of osteosarcoma except low-dose methotrexate, ifosfamide, doxorubicin, cisplatin. Now see, this osteosarcoma has been asked a couple of times, not in recently, but around 7 to 8 years back, they have asked. 7 to 8 years back, they have asked. All right. So all of the following are used for treatment of osteosarcoma except. Let the answers flow. Let the answers flow. Let the answers flow. Let the answers flow. Very good, guys. Very good. Excellent. It is not low dose methotrexate. It is, we use high dose methotrexate with leucovorin. High dose methotrexate with leucovorin is used. Ifosfamide can be used. Doxorubicin can be used. Cisplatin can be used. All of these drugs, they can be used in osteosarcoma. So we use high dose. Low dose is not used. Excellent. A patient of hairy cell leukemia should be started on antifolate drug, purine analog, pyrimidine analog, alkylating agent. Very good. High dose needed. Very good. High dose needed. So all of you are correct, guys. A patient of hairy cell leukemia should be started on antifolate drug, purine analog, pyrimidine analog, alkylating agent. So hairy cell leukemia, this is again a PYQ, but it is not exact PYQ. You know, right? If I ask a PYQ, I change it, right? This is not exactly a PYQ. So change the MCQ. This has been asked. Cladribine. So very good. All of you know that the drug of choice is cladribine. So what I'm asking is, what is cladribine? Cladribine, okay, fine, you know cladribine, but I've added one difficulty level more to cladribine. I'm asking, what is it? Antifolate, purine analog, pyrimidine analog, alkylating agent. See, that is the reason why if you'll mug up just drug of choice, you might not get this answer right. You must know what is cladribine as well, right? So what is cladribine? Is a purine analog, guys. Cladribine is a purine analog. So remember, for leukemia, mostly for leukemia, we use purine analogs. Remember this. Why? Because see, purine is important for survival of lymphocytes, right? So lymphocytes, you know, they don't have salvage pathway for synthesis of purine. They have only de novo pathway. And in block purine synthesis, the de novo pathway, lymphocytes, they undergo toxicity. So remember, purine analogs means what? Leukemia, different types of leukemia. Like fludarabine is used in CLL, right? Cladribine is used in leukemia. Pyrimidine analogs, it mostly means colorectal cancer, guys. 5-fluorouracil, capecitabine, right? Right. So pyrimidine analog means colorectal cancer. All right, guys. Now, guys, we have reached to the last MCQ for today. Painful leg ulcers can be seen with a drug that is used for treatment of. Painful leg ulcers is a very specific side effect. And again, this is an MCQ that has been asked many years back. It was asked. And this drug that I've asked is very relevant today. Is very relevant today. Do you guys need a clue? If you guys need a clue, let me know. Do you guys need a clue? Is very relevant. Is very relevant. Okay, let me give you one clue. It is very relevant to our country, India. It is very relevant to our country, India. Is very relevant to our country, India. The disease is located in, is mostly seen in Odisha, in the Sundargarh district. That is the last clue I can give you. In Odisha, in Sundargarh district. All right. Sickle cell anemia, very good guess. So here we are talking about sickle cell anemia, hydroxyurea. In Odisha, you can see it mostly in the Sundargarh district because how do I know that firsthand is because I belong to a caste called as Agriya caste. There is an Agriya caste in Odisha. I belong to that caste. And in Agriya caste, people, they get married between cousins and all, consanguine marriages, right? And that is the reason why there is a high risk of sickle cell anemia, right? So hydroxyurea can cause painful leg ulcers. Hydroxyurea, it can cause painful leg ulcers, right? So it is an inhibitor of, very good. Avinash Panda, very good. It is an inhibitor of RNR, ribonucleotide diphosphate reductase. Hydroxyurea is the drug of choice for sickle cell anemia. It is also drug of choice for polycythemia vera. It is also drug of choice for essential thrombocythemia. Three conditions where it is drug of choice: sickle cell anemia, polycythemia vera, essential thrombocythemia. Right, guys? So this is what we had to discuss today. Now, before I sign off today, guys, let me give you the schedule for. Let me give you the schedule for next week. Which is the next week? Let us see. Week. Is this? Let me check. Week 9. Yes, guys. So you can take us, a picture of the next, because a lot of students, they later comment in the video that they are not on Instagram, because on Instagram I post the schedule on Instagram. So if you're not on Instagram, you can take a picture of the schedule for next week. And we have reached week 9 from Monday to Sunday. We'll discuss antiaggregants, anticoagulants, peptic ulcer disease, prokinetics, antiemetics, laxatives, antidiarrheal, and some new drugs. You can go through the new drugs as well, right? All right, guys. So that's all for today, guys. And you guys were real sport. And tell me, guys, with what are you guys more comfortable, with a premiere or a live session? Please let me know in the comment box, right? Depending upon how many of you comment, the more comment is about live session or premiere, I'll do that. So whatever you guys like, should I do a live session or a premiere? Whatever you like, let me know in the comment box. What do you guys want? So if you guys would ask me to do a live session, next one I'll do a live session. If you'll ask me to do it a premiere, I'll do it a premiere. What do you guys think? So whatever you guys say, if it's a live session, I'll do a live session. All right, guys. Live session it is then. I'm at your service with the next live session. I'll do it live. And just let me know, guys. Let me know one thing. Is this I'm doing this weekly pharmacology for a purpose: read, revise, re-revise. Let me know in the comment box. Is it helping you guys to retain pharma? Right? Let me know. Please let me know in the comment box. I just want to know, because it's It's a live session, and I just want to know from you guys that is this weekly pharma where we're doing bits and pieces day after day, day after day, day after day, is it helping you to retaining pharma or not? Is it helping us to retain more, right? Then as usual, as used to study. So पहले जैसे आप पढ़ते थे, right? अभी जब हम वीकली में पढ़ रहे हैं, पहले पढ़ते हैं, फिर रिवाइज करते हैं, री रिवाइज करते हैं, तो उससे आपको रिटेंशन बढ़ रहा है कि नहीं बढ़ रहा? रिटेंशन बढ़ रहा है कि नहीं बढ़ रहा? देखो, अगर रिटेंशन बढ़ रहा है आपका, अगर आपको फायदा हो रहा है, राइट, तो मेरा जॉब डन है. बिकॉज सी, फार्मा इज अ वेरी वोलेटाइल सब्जेक्ट, एंड दैट इज द रीजन व्हाई दिस इज व्हाट आई यूज्ड टू डू. सो देखो, अभी भी नीट पीजी में आईएनआईसेट तो आ ही गया, समझ लो, राइट. नीट पीजी में अभी भी बहुत टाइम है. देयर इज अ लॉट ऑफ टाइम फॉर नीट पीजी. अगर 19 सब्जेक्ट में, अगर किसी सब्जेक्ट्स में आप अभी कमजोर हैं, इफ यू आर वीक इन सम सब्जेक्ट्स, तब आप उसमें एक काम करिएगा. सपोज आप माइक्रो में वीक हैं, तो ये वीकली फार्मा खत्म होने के बाद आप खुद अपना वीकली माइक्रो या वीकली पीएसएम या वीकली पैथो, जिसमें भी आप कमजोर हैं, whichever subject you're weak in, you can plan your own weekly micro patho, whatever you want. So this is what I used to do. I did this weekly thing when I was preparing for All India PG for pharma, micro and biochemistry. 3 subjects I did. All right, guys. Naman Modi is asking to take one session before INICET. देखो, मोदी जी कह रहे हैं तो लेना तो पड़ेगा भाई. मोदी जी कह रहे हैं ना, तो मोदी जी आ जाएंगे रात को 8 बजे. मित्रों, आपने सेशन नहीं लिया तो लेना पड़ेगा. So I'll take a session. Naman Modi, I'll take a session, right? All right, guys. So thanks a lot, guys, for participating in this session. And you guys are real sport. And even I enjoy these live sessions, right? I enjoy these live sessions. And please continue this good work, right? Week after week. And I want to share one thing before I sign off for today. One student messaged me a week back that he will finish his course, his first reading, barely by 20th of October, and he was asking me, sir, what should I do? Before, I don't have much time before the INICET exam, so should I prepare exclusively for INICET for those 15 days or whatever, or should I keep preparing for NEET PG? Now see, the answers would differ from person to person. I'll tell you what I did. So I was in the same situation when I was preparing, and November 2nd week was the AIMS exam that I was supposed to give, and I could barely finish my course by the end of October. So I had 12-13 days before AIMS, and I knew that even if I do anything in these 12-13 days, I'll not be able to crack AIMS, right? So I kept preparing, keeping NEET PG as my ultimate exam, and I went for AIMS exam. I gave AIMS exam. Just as another grand test. I would give another grand test. So I had a practice of exam before the NEET PG. So I did that. Now it's entirely up to you guys, right? Everyone has a different point of view. All right, guys. So guys, take care, guys. Bye bye. Lots of love and blessings to all of you.